So time is 7:21 right now.
Big news. I have some important news for you. Interesting news.
It's Blake and Darren's Spilling the Tea with Sandy.
K-Man's top news headline from CMR.
Good morning, Sandy.
Good morning, Blake and Aaron.
Good morning.
How are you?
Fantabulous. How are you guys?
We're good.
Great.
Got some headlines for us this morning?
Yes, absolutely. So the RCIPS are continuing to work extremely hard over the last week or so. They're still looking for that wanted gentleman still in the loose, but they're making some progress with some individuals that they did arrest recently. So they have now formally charged 3 men in relation to burglaries and trespassing incidents. So they arrived in court yesterday, made their first court appearance. We got a 19-year-old from West Bay. We have a 33-year-old from Georgetown, and we have a 45-year-old. So it kind of interestingly enough ran the gamut in terms of the age spread.
It's sad to hear about when they're still teenagers. They just don't understand the weight of what they're getting themselves involved in, and repercussions for the rest of their life.
What are you doing at 45?
I know, right? That's what
obviously, but that's a whole different can of worms. It's just the young kids that get involved with these adults that maybe they are,
Are these local people?
Yep.
Okay.
Pretty much. So interestingly enough, as you say, age doesn't seem to matter much, but I hope the 19-year-old realizes that unless he makes a drastic change at 45, he'll still be, on that same path if he's alive.
Right.
Absolutely.
Yes. And the other gentleman that was apprehended on Friday, he arrived in court as well. And he has been denied bail. So the audacity of Aaron Brian William Soto in summary court yesterday made his first appearance to actually request bail after what happened on Friday is amazing.
Oh, this is the other person that...
Yes, this is the one that they apprehended.
Oh, yeah. You ran away from police and then you're going to get bail?
Yeah.
Been watching
not likely.
TV.
Okay.
Not likely at all. But he's facing charges of illegal gun possession and, probably other things that they're going to add on as they continue. So
Evading and eluding.
Yeah. I mean, trying to
we'll
jump
get
in some way.
We'll get a bit more,
or that.
We'll get a bit more information on that. And the Department of Environment is warning us that it is going to be an interesting couple weeks for mosquitoes. So in case you missed this announcement, get ready.
Yeah,
to be
already started
tackled by mosquitoes.
It's bad out there already.
Yeah, got attacked last night.
Yeah.
Oh my gosh.
I thought they were going to fly away with me.
Yeah.
There were so many on my arm.
Check your surrounding property for any standing water or anything else really that could be contributing to the mosquito problem.
I did that last night. Actually, the watering can that we have, like sprinkling can.
Oh, yeah.
That's out by the garden. Was sitting, normally, and it was full from the rain. And I went to empty it, and like a big swarm of mosquitoes flew out of it. And I was like, holy crap.
Yeah, you got to get all that stuff out.
Yeah.
Yep, definitely get on it. It's going to be in your best interest. But in addition to that, we have the DART scholarship application deadline quickly approaching. So if you're a young person between the ages of 17, Caymanians, between the ages of 17 to 25, with an offer, even a conditional offer from an accredited institution, you can apply for the William A. Dart Memorial Scholarship, University Memorial Scholarship. And the deadline is May the 19th. So please, young folks, if you're looking to go to university and you might need some financial assistance, this is a wonderful opportunity to help at least partially pay for your scholarship.
Nice.
So 85% of the Dart University graduates move on to do their master's or doctorate programs as well. So that really, I think, spells how positive the Dart Scholarship Program has worked out for these young people. 6 of them are already in the workplace as alumni, and 2 are gaining work experience. 2 at Dart and 4 abroad are actually gaining work experience as well.
Awesome. That's wonderful to hear.
Yeah, very cool.
So lots of positivity there.
Cool.
All right. Those are your news headlines for you today.
Excellent. Thank you, Sandy. And you can catch Sandy's show right now on Bobo 89.1 FM coming up at 7:30, about 4 minutes from now. And
Awesome.
we'll catch you tomorrow on
Okay,
KISS.
guys.
For more
Have
headlines.
a good one.
You too.
Bye.
All right. Bye-bye.
Our segment with CMR brought to you exclusive.
All right, folks. Just give us 1 second. Good morning to everyone. We got a couple minutes before we will go live on radio. So let's go ahead and do some housekeeping while we get ready for that. And we're going to be talking about mental health today. So I hope you guys really tune in. Tell everybody, who has, not even suffered mental health, but just wants to know a bit more about it to tune in. All right, folks, we're about to go live on radio in just a couple seconds. Thank you guys so much for tuning in.
Peppermint, sorrel, ginger, beaver grass, or English. Get it ready. Your morning tea just got hotter.
Ooh, honey child.
On the cold, hard truth. Bobo 89.1 and Cayman's #1 talk show are bringing you morning talk like no one else. Monday Rewind, Impact Wednesdays, Caribbean Connections, and much more. Don't miss a beat with what's happening in the local community. Just keep sipping your tea.
What a mess.
Here's your host, live and direct from the Cayman Islands, Sandy Hill.
morning, everyone. Rise and shine. It's a beautiful Tuesday out there, May the 3rd. Let's get it, folks. May has so many things going on in the month of May. I must tell you that and it's an exciting month to be able to talk about a number of different issues. And one of those issues is actually mental health, which we're going to have our rundown at Tuesday. Experts from Health City on the program today and focused all on mental health, mental wellness. And I know it's been a tough time in the last couple of years, really, for all of us in that particular area. And I think we could do with some positivity, but most importantly, finding out how and when you need to get some help for any sort of mental stresses that you might be facing. Mental wellness is something, folks, that we have to prioritize every single day. So let's say good morning, first of all, to all of our viewers. We've got Irvlyn, who's got it locked first this morning. Good morning, Irvlyn. How are you? Marshall is here from North Carolina. We have Rita, who is joining us. Buenos dias, Rita. Who else have we got here? We have Miss Corrine. Hey, Miss Corrine, we've not seen you in a minute. What's going on in the beautiful district of West Bay? Tell us what's going on. Josephine is here. Good morning to Josephine. Wee and Siobhan both have it locked. Michael, good morning to you. He says it's so great to be here. Thank you so much. Can I tell you that there's so many people who are absolutely appreciating that they can capture the show. I had Mr. George call me yesterday, and he was saying to me, oh my gosh, I'm really loving getting the show every morning. And I thought he was listening to it on radio. So I said, well, that's great, because I know the radio audience has been amazing. But he said, no, I'm getting it on YouTube now. I think he just figured out YouTube. So he said, every single morning I've got it locked on YouTube. It's something that he really enjoys watching and tuning into every single day. And he said that his son, likewise, is always locked to the Cold Hard Truth. So good morning to Diamond Princess. Good morning, Olivia. Miss Beulah's here. Virtuous Panook is also here. Louis joining us from Detroit. He says, good morning, Sandra and CMR Massive. Happy Tuesday. Irviton's got it locked. Quincy joining us from the BRAC. Quincy says some people with issues keep their business to themselves. I don't live in denial. Well, Quincy, we're going to get to that, because I know this is an issue that is very near and dear to your heart in particular. Melicia, good morning to you. Trisha, so good to see you. Richard, of course, is joining us. And we have Celine, who says, I totally enjoy your show. Keep up the good work. All right, well, let's get this train underway. Buenos dias to Luis as well. This is such an important topic. In fact, here at CMR, we have for a minute now been working sort of behind the scenes with Kevin and Misha. And I don't know how far they've gotten, but I do know for sure that they are working on a mental health segment. I'm not sure if it's kicking off this month, but this month is Mental Health Month, Mental Health Awareness Month in the US. So of course, this would be the perfect month to really get that program kicked off. But it's difficult to get professionals together. And now that we know, I didn't even know that there was an expert at Health City in the psychiatric field. So this is absolutely wonderful to hear that we have Dr. Diwakar, I hope I haven't sorry that, Sharma, who's a consultant psychiatrist on board. So let's welcome Dr. Diwakar, I think is probably how it's pronounced, to the program.
Yeah, thank you. Good morning.
So it looks like we might have a little bit of a frozen situation there. So we'll give Dr. Sharma just a second, maybe just a little refresh on the browser there. And then I'm going to pull in Shamari Scott, who is the Chief Business Officer over at Health City. Good morning, Shamari.
I was just saying, you're not going to let me in, or what? Morning, Sandy. Morning, Cayman Islands. It's a pleasure to be here. And as you mentioned, a lot of times people don't realize the full scope of services that we have at Health City, which is why it's important to have programs like this. And we're always talking about giving holistic care. And obviously, mental health is a portion of that holistic care that would need to be given. So we were very fortunate. We had a psychiatrist prior to Dr. DeWarker, but he would have joined us in 2018. So he's been with us for almost 4 years.
Oh,
It's a
wow.
pleasure to have him. And when you think about things, even like, remember we were talking about bariatric previously,
Mm-hmm.
Sandy, and we'll need to have a full program on that. But the psychiatrist is a portion of that, right?
Mm.
To ensure that people are in the right mental space. And it's a holistic type of program that we have that takes in many different consultants, and everybody has to agree that this is the perfect candidate for us to move forward, as just as
Mm-hmm.
an example of how you need an integrated team to try and get the best results. I see Dr. DeWarker here with us. So, Dr. DeWarker, I was speaking sweet nothings about you while you were off, but
So
also just
yes,
wanted to quickly mention that Dr. DeWarker is a specialist in um, alcohol de-addiction, drug de-addiction, tobacco de-addiction,
mm,
depression counseling. He also has deals with psychological counseling and schizophrenia disorder. So there's a wide array
wow.
of what Dr. DeWalker can do, and many other things as well. So I just wanted to make sure that we highlighted that on the front end, and then obviously we can take the conversation from there.
Oh my gosh, that's amazing. Yeah, I honestly did not know this. So this is, like I said, very, very good news, because I feel like even on an island this small, we see oftentimes um, the indicators, if you will, that there are mental health issues and that people are in a bit of a mental health crisis. And in fact, just a couple of days ago on Sunday evening, we had a gentleman close to Health City who was literally trying to walk into the ocean in the evening hours. Clearly, that is someone who is struggling with some sort of mental health issues. We obviously don't know the full scope of the situation. And, a lot of people were there on the scene, and there was video footage coming out. And one of the observations that I made is there were a lot of people, his brother, I think, was there praying for him. And whilst everybody knows the power of prayer and meditation and your spirituality being extremely important to your mental health and your physical well-being, sometimes you need a physical person right here to be able to sit down with and have a conversation with. Dr. Diwakar, sometimes in the Caribbean, there's a lot of stigma that's attached to mental health. I know it's worldwide, but I feel like some jurisdictions have kind of moved ahead a little bit. And in this particular region, we still struggle to talk about the fact that it's like we need to have a hashtag Me Too movement for mental health, where people can openly say, I suffer from depression, I suffer from bipolarism, I suffer from all of these things. And just over the weekend, we had, oh gosh, what's her first name? Winona Judd's mom. Help me out here, Shamari. Do you know, you're probably like,
What?
that's too old for me.
Oh, that my wife mentioned it is
It'll come to me in a second. So basically her Naomi Judd.
okay.
Miss Naomi died over the weekend. She was 76 years old. And the initial reports on Saturday when she passed away, her daughter said, her life was shortened because of mental health. And I thought to myself, oh, that sounds like, a suicide situation. And now we do have confirmation, I should say, that she has passed away because of suicide. And her family issued a statement. And it's so sad at the age of 76, you think you're in your golden years. And I think that proves that mental health, there's no age limit to people who can struggle from mental health issues. It can be, preteens, teenagers, kids, people in their 20s. It just rolls on well into your senior years. And it's unfortunate that she was not able, and she struggled for a number of years with depression, and she was not able to kind of get that under control. So Dr. Sharma, you're here to tell us that there is help that's available, but let's talk about some of the stigmas that surround mental health.
Well, thank you. Good morning, first of all. I could not connect immediately when you said good morning. Yeah, so stigma is one of the reasons why we are here. We are celebrating Mental Health Awareness Month. I don't think that stigma is something that is limited by borders. I have worked in 2 countries so far, and I can vouch for it that mental health problems go beyond borders.
Right.
One of the common misconceptions or uh, stigma-driven misconception is that mental illnesses are not common. They're in fact very common. Every 1 in 5 person goes through something close to mental illness at some point in their life.
Wow.
So we are 3 people here. If we were 5, then one of us would be definitely going through something which would be hard to tell or describe in words for them. And that's one of the reasons, one of the few reasons which I feel that we are not open about our feelings to many people, which is quite right in most situations. But in difficult situations, in states of being where it is hard to acknowledge how better we can be or how we can deal with situations that are hard to deal with, we close down even more.
Right.
And these misconceptions have only grown with time. For example, I agree that the history is not siding with mental health providers. The history is actually promoting a lot of more stigmas. The history of asylums, history of how mental health patients were treated in the past, the kind of side effects people get from medications, and and often a binomial which people consider that mental illness is the other side of the coin, such as being more unpredictable and violent. That's a huge misconception. I would like to say and clear it out that only 1% of people who have a mental illness are unpredictable in the sense of the word unpredictable or violent at times. But even then, there is a lot of predictability about what makes somebody violent.
Yes. And let's just make sure that we understand even what a stigma is, because some of our listeners may be tuned in and not quite familiar with that term. So, stigma is basically when someone views you in a negative way because you have some sort of a distinguishing characteristic or personal trait that is thought to be a disadvantage. So, it's a negative stereotype, right? And unfortunately, there are a lot of negative stereotypes and beliefs towards people who have some sort of mental health condition. We hear it all the time, folks, in our community, and sometimes we it's noticeable the way that we refer to people with mental health issues. We literally call them crazy, and we talk about people who've had maybe a history of mental health, even if they're in recovery or they're in a better place. One of the first things that we tend to do when we're having a discussion about them is, oh, remember when he was walking around with the proverbial parrot in his shoulder or whatever. These stories become part of our collective history as a people, and yet you have to challenge yourself to look at people in a much more holistic way and see that people are so much more than whatever mental health issues they may have suffered from. Because quite frankly, and I think Dr. Sharma can certainly agree with this, the harmful effects of the stigma are many. And so can we talk about what are some of the effects in a real way of how having this negative stigma attached to mental health can impact not only those who are suffering from it, but their families and the larger community as well?
So true. That's a very pertinent question. I believe stigma affects every aspect of mental illness, right from the identification of it. We sort of start with that stigma that, oh, I should not be having that illness.
Right.
It better be a heart disease, or it better be a physical disease than be a mental illness. And that's just identification. We move on to diagnosis. People are afraid to seek help for it. They would not speak loudly about it. They know that they're lacking something that's affecting and influencing their behavior, their ability to perform at their optimum, but it would stop them from seeking help. And then once things get out of hands or they become too worse to be handled by one's own self, uh, leave alone help, uh, the treatment also becomes harder to continue if they start. For the families, it's of course a matter of shame, guilt, or maybe even resentment. So, matter of fact is that people feel that people with mental illnesses often are perpetrators of violence, but in actuality, they are the victims of violence.
Right. Wow. That's so incredibly powerful. So, folks, some of the harmful effects of the stigma include, as the good doctors say, a reluctance to seek help or treatment. So, you've got to get a proper diagnosis first before you can get a treatment plan that will be effective for you. So, even admitting and saying, I'm struggling, I'm having an issue right now, is, one of the ways in which, your progress can be delayed because you are fearful of what other people are going to think, what your family is going to think, what society is going to think. And so a lot of people will suffer needlessly in silence. And it's so interesting, doctor, that you said that, people would rather come in with a physical ailment like, oh, I've got a heart disease, I've got cancer, I've got, not that anybody wants any of those things, but it's so much easier for someone to get sick physically and have people sympathize with them as opposed to having a mental health issue and knowing that you're going to be stigmatized or people are going to look at you a certain way. There was an example of this recently. I found out that one of our MPs, and I feel like mental health struggles is something we should all start to share our individual stories so that we can join together and have this collective story of how, yes, like I said, a hashtag Me Too movement I suffer from. And then you say what it is, and you realize that, like you said, 1 in 5 people have some sort of a mental illness. But, I was always kind of a little bit harsh on a particular MP. And recently someone said to me, Sandy, this individual actually is on medication to really, keep this particular mental health situation in check. And so what people don't realize is sometimes that it impacts their ability in a physical way to do certain things, and they have to take their medication at a certain time of day. So maybe the afternoon hours are a bit more of a struggle for them because of drowsiness or whatever associated, being a bit more lethargic associated with the medication. And, once I knew that, I really had to reevaluate, even in the world of politics, how I view this individual. And I thought, well, why is that something that they're not sharing with the community? Because I think a lot of us would love to hear more of those stories so that, everyone knows that you're not alone in these struggles.
Yeah, so true. If I can add to it, that as human beings, we are always afraid of the unknown, what we don't understand, and once the understanding comes, the fear goes down. We are still in that phase about mental illnesses, that we are scared about them. We make our assumptions about them, and our fear speaks very loud when we think about somebody as mental ill. So that unpredictability, that fear, is what drives that stigma, I guess.
Yes. And fear can be so incredibly powerful. Okay, so good morning to everyone. Don't forget, please, that if you've got a question for our guest this morning, you're free to call in 936-2626. The discussion of May is Mental Health Awareness Month. And so we're going to be talking a bit about mental health this morning. So please do, ask questions. This is your opportunity to get some more information and to learn, in relation to anything that you want to know about mental health and wellness, addiction problems as well, is also covered in this. So some of the harmful effects, I'm just going through a little bit of a list here of the stigma, includes a lack of understanding by family members, friends, coworkers, and others, and fewer opportunities for work, school, or social activities, or trouble finding housing. So there is a lot of discrimination, obviously, for people who are suffering from mental health issues. And I think this is evident in the workplace and the schools. Can we talk a little bit about some of the discrimination that people are facing on a daily basis?
I believe, sitting in an office, I can only tell you about people who come to me, and it pervades all aspects of our society. It starts from our neighborhoods, or maybe even in our families. Our preferential treatment for people who apparently don't show any signs, or people who are working, once they start being ill, or if they start seeking benefits for illness, it becomes a bone of contention at workplace, or in relationships, in seeking partners. This plays a huge role, that if somebody comes to know that you are mentally ill and you're seeing somebody for it, people are afraid to open up about it to anybody, even their closest relationships.
Right. Wow. Bullying, physical violence, or harassment. So you just mentioned, Dr. Sharma, that, although there's this misconception in the public that people who suffer from mental health are more likely to be violent, the fact of the matter is they're more likely to be victims of violence.
That's true, because one most important aspect of being mentally ill is that you can't speak for yourself. And people who are opportunists, people who are not, people who are inconsiderate of someone else's emotional state, they often choose to be what they should not be, I guess, for the lack of better words. Bullying is an important example of it. It's not that the victim is not sick. The perpetrator himself or herself is equally sick. It's just that it's their way of expressing it, and there's somebody to take it when somebody is there to give it.
Right. Wow. So we do have some comments coming in from our audience this morning. So let's go back to Quincy's comment that he made earlier in the program. Quincy says, "Good morning, Sandy. Some people with issues keep their business to themselves, and I don't live in denial and sharing mine with the world. It's come to haunt me." So Quincy, I think, Quincy, correct me if I'm wrong. And Quincy, by the way, you're free to call in the program if you'd like. But I do believe that Quincy has suffered or been diagnosed with one of the things is bipolarism, and that's there's different types of bipolarism, but I think that in the research that I've done over the years is one of the more difficult mental health issues for physicians to actually address, because it requires the balancing of medication, and sometimes it can take years to really tweak an individual's medication to the point where they can be, functional in the way that they would like. Can we talk a little bit, Dr. Sharma, about bipolarism? We see some very public examples of it. Individuals like what's his name? Kim Kardashian's husband. Help me out, Shamari.
Kanye West.
Kanye West, for example.
That one I know. The other one, the mother. I'm
He
1 for 2.
suffers.
Sandy, 1 for 2.
Yes. He suffers from bipolar disorder. And, there's been a lot of famous people. I see a few people picking up on this. Damon says a lot of people suffer from mental health, but they're wonderful artists. They write music, books, movies, plays, whatever. And Kanye West is no exception to that. I mean, he's extremely artistic, really brilliant with his music. And so sometimes people, I don't know if this is true or not, but people think, that there is a requirement to back in the day we would say you've got to have a little bit of madness in order to be artistic, but I know that isn't true logically. But why do people think that? Why do people associate mental health issues, whether it's depression, Salvador Dali, for example, or whether it's bipolarism, with artistic abilities as well? Is there a real connection there?
Well, history tells us that there is. A lot of good work has come out of people who are in a hyper state or a manic state of bipolar disorder. But in today's era and time, I guess we are trivializing something very severe, something very serious like bipolar disorder, because we have made this word a part of our normal conversations. Anyone who's having mood swings, anyone going through anger issues, we often try to label them as bipolar.
Right.
And we use this as a very casual term. So I have a problem with that because people who actually have the illness, they will never be able to seek help for it, because they think that it is normal to have bipolar disorder, because you're just continuing with your life even though somebody's labeling you with a name. So I feel that this is something that we should be very aware of in our conversations with people. So many terms like that, so many mental illnesses like that.
Right.
Often it has come to a point where people often diagnose themselves with so many things. They call themselves ADHD, OCD, which are acronyms for very serious problems, which affect people emotionally at the deepest level.
Right.
So
I mean, I'm thinking about this because this is quite an important concept that I don't want to underplay. So on the one hand, maybe there's some stigma attached to mental health, but you're saying that in some ways we're also misusing labels, of course, self-diagnosing, and maybe even glorifying a little bit some of the mental health, illnesses that are out there. Because everybody kind of throws this around like, oh, I'm a little bit OCD. Like, what does that even mean? That you're a little bit OCD? Because OCD is a very, very serious disorder, and it's not something that is easy to control or easy to help. So people think that because they're like super neat and they like things a particular way, that has somehow elevated them to being a little bit OCD. But that's a misuse of the term, a misdiagnosis, and I think in our attempts to maybe glorify the term, we're probably doing more harm to people who actually do suffer from those types of disorders.
Yes, it makes me happy that we are talking about mental illnesses, but I'm also unhappy because we are not using it in the perspective or the correct way of using it. You just talked about a famous person who had bipolar disorder. I'm sure there are so many examples throughout the history, but it gives an opportunity to discuss those problems. But we should be very careful that we are not doing or using these terms or names or labels to identify with those famous people, because it's a human inclination to identify with someone famous or someone who's of better resources. So, yeah.
I have a question. Dr. DeWarker, what type of signs or signals should you look for that would determine whether or not you may need to seek professional help? Because as you mentioned, a lot of times, persons may think or they have a certain disorder when they actually may not, but there are others who may not keenly be aware that they need to seek help and just think that the world is against me or something if they have erratic behavior and as such. What are some of the symptoms that either parents or friends or wives or husbands should be looking for, or you yourself, that would tell you, you know what, maybe I need to speak to a professional?
No, of course. I mean, thank you for that wonderful question, because it helps us fight stigma. It informs people. So the list of symptoms is endless, but I would like to touch upon some important questions, some important signs which we often see. If we are seeing somebody getting unusually angry, a change in their behavior which is unusual for them in terms of how they do their work or how they help others, or if they are too talkative or if they have become less talkative, if they have become more physically active unusually or less physically active, if they're indulging in their pleasures as much as they used to or not, if they are restricting their options in life, like they don't like to go out anymore in contrast to if they were doing it earlier. Sleep, if they have not been able to sleep too well continuously for beyond a few days, and it's influencing or affecting their ability to perform at their work or their life, socially, personally. These are few symptoms I think that most of us can see or think of. Then there are certain specific illnesses which are clearly going to stand out. It would not be something that you normally sometimes do and then get better on their own. OCD is one of them. OCD can present in so many ways and symptoms that it could be a talk show of its own. So I feel that even though we might have a bit of everything that I just described, that we do get sleepless sometimes, we do get angry sometimes, we do behave unusually for instance, but if there is a consistency and a pattern in it, and if it is having an influence in our ability to function in our society, in our professional life, in our personal life, then we would qualify it for having a disorder or a mental illness.
I think you're on mute, Sandy.
Thank you, Shamari. I was just saying that it's so interesting that you talk about the diagnosing, the properly proper process of diagnosing someone with mental health, because I know a lot of people have been, sometimes we look at celebrities and we think, oh, they have such a fantastic life and they're rich in money and whatever, but they have just as many issues as the rest of us, if not sometimes more. But, everyone has been, a lot of people have been tuned in to this Johnny Depp and Amber Heard fiasco, this trial that's been going on. And I've watched a couple snippets of the testimony, and there was a mental health professional actually on there who was giving her diagnosis of Miss Amber Heard. And, she talked in great detail about how she carried out her function, and how she actually diagnosed, I forget what the eventual thing was that she diagnosed her with, but she talked about, the manual that's used by mental health professionals, by psychiatrists, to make this type of diagnosis. And when they classify, how they define and then classify abnormal behavior. So the 3Ds: dysfunction, distress, or some sort of impairment, and deviance. And I don't know that deviance, it kind of sounds, kind of like it's not a great thing, but you talked about some of those signs, other things, changes in feelings or demeanor, loss of interest. You mentioned change in sleeping habits, because that can be extremely, extremely important. Low energy, difficulty interacting with people, even your appetite loss or gain can be an indication, as well as uncontrollable emotions.
Yeah, that's true. That's true. That's, as I said, the symptoms are endless if we go on about them. There are eating disorders that are associated with it. There are sexual disorders. There are sleep disorders. A lot of disorders associated with impulse control.
Right.
But those are not as common as I would like to think of people with anxiety and depression are. We come across them as almost 80 to 90% of our practice.
Wow. And so, folks, mental health can touch anyone. I want to give some, we like to, again, look at celebrities because we think somehow they're different than us, but in many respects, they're no different. So I want to give some examples of some who have suffered from mental health issues that you might be surprised. Mariah Carey, for example, was finally diagnosed in 2001 with bipolar disorder. And she said that she lived in denial and isolation for many, many years. And she finally sought treatment after a series of professional and romantic issues. So sometimes it becomes obvious that there's a problem through relationships. You can't sustain positive relationships, whether it's romantic or in your personal life or even with family members. So that can often be an indication that there is something that is wrong. And she said that she, got treatment and she put positive people around her, and she was able to get back to what she loves to do, which is writing songs and making music. Carrie Fisher from Star Wars, you guys might remember her. She actually wrote a book in 1987 called Postcards from the Edge when she was in rehab and after a near fatal drug overdose. So we'll talk in a second here, doctor, about the connection of mental health and drug abuse or drug use as well. But, she also called for greater attention and research on the condition of bipolarism. And of course, we know that unfortunately she died in 2016 of a heart attack. We have Mel Gibson, so another one who shared that he's also bipolar. And he said that sometimes on scenes when he'd be acting as an action hero, he would burst onto the scene, and, his desire to produce and direct and do all this other stuff often came during one of his manic phases. But guess what? He was named the sexiest man alive in 1985. And he's made a lot of headlines, as you know, with some of his antics over the years, but seems to be doing a lot better these days. Demi Lovato, so a lot of our young people might be able to relate to this younger singer and actress who grew up on Disney Channel. And she has also suffered for years now from mental health issues. And she talked about, her addictions and self-harm as early as 2010. And she has also been diagnosed with mental health, bipolar disorder and specifically. Russell Brand, so another one, and again, sometimes we look at these individuals, we think, oh, they're just, they're exuberant, they're different. We use different words to describe them. And really, I think mental health can mask itself in so many ways.
Yeah, these are just some celebrities people get inspired
Yeah.
from,
Yeah.
and
Absolutely.
yeah, their work is inspiring, but what they go through behind that work
It's very
is
sad.
definitely not inspiring.
Yes. So Damien says some mental health issues even get persons in leadership roles like presidents, and many people relate and worship them. So it's entirely possible to have a mental health disorder and still be relatively functional.
Yes, I mean, when we talk about mental health related issues, we try to dissect them as if they are different from the body. Uh,
Mm,
we would be totally accepting if a president is going through a heart condition, or if he has blood pressure, or if he has diabetes. Having mental illness is not very far from being physically ill. I
mhm,
often tell my patients that you can't enjoy a a healthy body unless you're happy.
mm,
So, so your mental health is a crucial part of your physical health,
mhm,
and works the other way also. That even if you're mentally happy, but if you have a physical challenged body or a diseased body, then you won't be able to actually have anything to do to enjoy it.
mhm. One bit of advice here in terms of how you cope with the stigma. Number one, obviously get treatment. And this is where Health City has services available to everyone in the community. So, you know, if you get the help that you need, folks, that will help you with the actual condition. So let's look at some of their um, I think I've got the wrong flyer up here. Some of their available services in the mental health field. So, Dr. Sharma, tell us a little bit about people who want to get help, how they can reach out and how they can get in contact with you as well.
Um, so first of all, one has to really acknowledge the fact that they are going through something that they had not gone through in the past, or if they have been struggling with something that they have not talked about with anybody, they
Mm-hmm,
should definitely consider about it. Anything unusual, anything which makes them uncomfortable and they've not been able to change it on their own,
mm,
they should be the people who should reach out or at least try and talk about it. Uh, I think Shumari will be the best person to help us guide in the process as to
mm-hmm,
how to get uh, to reach to us.
mm-hmm. Absolutely.
Definitely. Sandra, as always, you can call 640-4040, or you can email us at info@healthcity.ky in order to get through to speak to Dr. DeWarker if you feel that you may need some help. And at the end of the day, if any of the symptoms Dr. DeWarker was speaking about, I think for the most part, it's if it interrupts your functioning in life, then you probably should reach out. And he may make various recommendations that could help you that don't always have to do with ongoing types of treatment as well. So it's just to identify what may be happening with Dr. DeWarker, and best case scenario, he sends you on your way with some things you can do at home in order to actually function a little bit better, and or if you actually need more treatment, we're definitely here for you as well. But I see, Sandy, you have up um, all of
Yes.
the various areas that we're able to help with. And Dr. DeWarker, at some point in time, I'd want us to talk on how you're able to help with drug addiction as well, and
Mm-hmm,
if there are any ties to drug abuse and certain types of mental illness as well, I think would be important for us to also touch on.
Of course, I did see that one of the viewers initially was mentioning about it that
mm-hmm,
uh, mental illnesses are exposing people to drug use, and that's very true. Um, so it has, uh, in the course of history, it has somehow come to be that we have found the right kind of chemicals to help with the right kind of emotions.
mm-hmm,
Uh, Attractive as they may sound sometimes, but they are just one of the ways to cope. Now, coping could be healthy and unhealthy, and I would definitely classify a chemical to be the not so healthy way of coping with stress or coping with what we are mentally trying to deal with.
mm,
So somehow it so happens that the two get clubbed together, and addiction per se, it's a it's a term that is not it's sort of not like these days in mental health circles, the word addiction. We would like to use the word called substance use disorder, because it is an illness. With continuous use of a substance, you do get a disorder which makes it harder for you to get away from it. So let me narrate a little story. That there was this boy who came, who went to go to a boarding school, and he was doing wonderful before he went, and he was struggling once he was in the boarding school. And then he somehow tries to get through it, but then he gets the news that his parents are separating. So this broke the back of the horse. So he just could not handle it at that point of time. Being away from the family, one of his friends introduced him to a hard substance. You can assume any substance in the world, for that matter. And it helped him to cope with those difficult emotions at that point of time. But somehow the struggles continued for beyond a few months, and he had to come back from boarding school because of the change in his behavior. His discipline was not up there as one would need to, and he came back to a broken house. So I am just trying to create an environment for people to understand that normal, usual things that we think are in isolation, they do have an influence on how we conduct ourselves. So repeated use changes our brain wiring in ways that it is so hard to not do it after a point in time. Otherwise, there is a reaction. Uh, I don't know if our viewers or listeners do acknowledge that alcohol is not very different from it. It also has similar ways of influencing our brain, changing our brain wiring, giving us troubles when we try to stop drinking. Smoking, even though alcohol and smoking have social acceptance, but there are safety limits to that also. How much you should be using, how much you should not do, what is harmful.
Right. Very interesting.
So many people do not realize that in our culture, drinking has got this social acceptance, and we often resort to it, thinking that it is a medicine that can help us feel better. But alcohol is going to make us more depressed in the long run. It would have an immediate effect that it would numb the pain, but it would make the pain more permanent part of our life because it depresses the brain. So depressing the brain will also depress those areas that help us feel alive and happy. So eventually, many people who abuse alcohol, they end up having emotional problems like depression and anxiety, because whenever you withdraw from alcohol, your body reacts, and that reaction feels like exactly how anxiety feels.
Wow.
People can get, yeah. So sleeplessness, again, a lot of people use alcohol to sleep better or maybe sleep at all. It works in the short run, but in the long run, it exposes you to have more serious sleep disorders. And as a function of losing sleep, more emotional problems. Leave alone the problems that come with not working or not being able to participate socially.
So I was really pleased to see that your treatment age includes some teens. So you start at 16 and above. Again, folks, everything from anxiety disorders, anger management, behavioral problems of late adolescents and adults, behavioral and psychological problems associated with different illnesses such as dementia, cancer, Parkinson's disease, and other physical illnesses. Because sometimes a physical illness can actually precipitate a mental episode of some sort. Yes?
That's true. That's true. That's very true for so many other illnesses. I would name a few here. Somebody who has had a heart attack or MI, myocardial infarction, or a stroke. These are more vulnerable people. People with epilepsy, people who have had head injuries or any traumatic brain injuries, people going through any nervous disorder, multiple sclerosis. These make somebody more vulnerable to mental illnesses. In fact, there are studies to advise that people should closely follow up with a mental health professional if they've been diagnosed with these illnesses. And vice versa. Somebody who has been depressed or living through mental illnesses, they are more vulnerable to so many other physical illnesses.
Mm-hmm.
The whole body mind thing.
So Quincy shares that he says bipolar can't get work, stigma, yet people admire my talents. How difficult is it in the mind of someone who is bipolar to fully come to terms with their diagnosis, especially if they themselves recognize that they do have certain talents, but your talents at some point no longer, I mean, I think there just comes a point in time where the talent isn't enough if you're not controlling the other issue, which is the bipolarism, if that makes any sense.
I hope I am not doing any injustice to somebody when I speak for them. But it's not easy to be in that state of mental illness. I mean, bipolar disorder, the name suggests that there are two poles. And these two poles are extreme examples. That one is where you are very productive, hyper driven, to the point that you create a problem for others around you. You talk too much, you get angry at the slightest things, you're not able to contain your reactions, you overspend, overindulge, take impulsive decisions. You don't sleep because you feel that you don't need to sleep. Careless relationships, you get into impulsive relationships, one night stands, which have consequences, and you do not realize the consequences because you're driven by something that's just making you drive. That's one extreme pole of this problem, whereas the other pole is exact opposite of it, an extreme severe state of being depressed, where you do not want to leave your house, you do not want to leave your bed, you don't have the energy, you don't have the drive, you do not care for anything more. uh, Things that used to make you happy don't make you happy anymore. You don't see the point of doing things, and you don't sleep, not because you don't need to sleep, but you can't sleep because of this overthinking that drives you up. And then there are so many people, most of the people who are between these two extremes. So people flip between the two poles sometimes. If you consider something in the middle, which most of us are normally, these people fluctuate a bit more than normal between these two poles. That's what bipolar disorder is. And
Yes.
a lot of times they would want to tap in the driven phase of the illness.
Yes.
But then it's not something they can control. It comes at a price to pay.
You know, my first experience with bipolarism, I was actually in university and I met a young man. I was just walking on the track trying to keep the freshman 15 at bay, kind of minding my own business. And I saw this guy moving like at lightning speed with a lot of energy. And then I recognized him as someone who worked in production at the school newspaper. And I was, you know, a writer at the school newspaper. And he stopped for a moment to like speak to me. And then in no time, I heard his entire story of his struggles as a teenager and going into his early 20s with bipolarism and how difficult it was to get this illness under control. And he was having, I think he was starting to enter a bit of a manic phase when I saw him like running the track. And he explained to me that, you know, sometimes the manic stage in particular, I mean, it's horrible to think that they're both equally as bad, but in the manic stage, like he felt this like just complete invincibility, that he could do anything, right? And that actually meant that he literally felt like he could jump off a building. He was a superhero and he would be perfectly fine. And so he was admitted to the hospital on a number of occasions where they literally had to put him in a straitjacket for his own safety, because they're like, no, you can't jump off a building. You're not Spider-Man or Superman or whatever. There are deadly consequences to that type of behavior. So I think they were still, you know, he was an active patient. They were still working very, very closely with him to try to get it under control. But, you know, having spoken to him over a number of months, I got a sort of firsthand, but not really too close, if that makes any sense, understanding of what some of the things people go through who suffer from bipolarism, I always thought, wow, it's like a bit of torture, like you're getting double tortured in a way, because you have the manic stages where sometimes you can be super productive, but a lot of people who, when they're going through their manic phase, they don't actually get anything accomplished. Like they're doing a lot, but they're not necessarily finishing any task and getting real things done. And then, you might go into the severe depressive mode where you can't move, you don't want to go anywhere, you're under the covers all the time. So for me, it was a bit of just as an outsider looking in, when he sort of explained some of what he had gone through, I always thought, wow, this is like a bit of a double whammy for him. It's got to be a bit of a personal torture, really.
Yeah, that's true. A lot of times it's hard to differentiate. There are different kinds of bipolar disorder also.
Yes.
But a few of them look very close to what a depressed person looks for, because most of the time, for most part of their lives, they go through depressive phases only. There are very few or very rare days or weeks where they might be in a less than a hyper state, but they would still be classified as bipolar disorder. A lot of times people are not identified as having the right diagnosis, which makes the job harder. A lot of people struggle with depression thinking that it's just plain and simple depression, but it's not. But you're talking about an important aspect of bipolar disorder, that people with bipolar disorder are very likely to use substance, or when I say substance, I mean all things that chemically influence us or affect our brain. Alcohol, smoking, all these are more likely in people with bipolar disorder or any mental illness. Exactly. There are more smokers who have anxiety than who do not.
Interesting.
Yes.
Yeah. I mean, I've always seen smoking as a bit of a nervous, almost like, I don't want to say nervous tick, but it's a nervous habit for sure. And I've seen that a lot of times when people quit smoking, they replace that physical movement with something else, like they always have to be kind of doing something. So Quincy has a few questions that are interesting. First of all, good morning to Emma. Emma says, good morning. Please talk about people with controlled mental problems who are capable to work and are yet stigmatized because of the size of this island and people's fears. Hats off to Dr. Lockhart and his fight for the facility, which should be completed by year's end. It's been long needed. Animal therapy is one of the best treatments for people with these conditions. So thank you, Emma, for those comments. How important can animals be? I think I see a lot of celebrities doing this, but I don't know if that's just like the latest fad, but a lot of people have emotional support, dogs at airports and stuff. How useful are animals in the treatment of certain types of mental disorders?
Yeah, they have their value. Definitely. They're very helpful to certain parts of people who suffer from certain aspects of what they suffer from. Just remember that we have historically been brought up in a culture where animals used to be some part of the family. We have grown into a society where we don't have that much. The dog or cat is most we can help with at this point. Horses used to be a part of the family at some point. So the value they bring to the table is that they help us in emoting to something that does not have a reaction. And it helps us to have conversations to ourselves, or a phase of reflection.
Right.
A lot of people who do not see therapists, they do have therapy with their pets. The relationship we grow with our pets it's an animal therapy too, in a way. But I want to be careful here that it is not a solution to everyone's problem. Some problems require different ways of dealing with it. Animal therapies have their own value that they bring to the table for some people. But we shouldn't be blanket that everyone should have a pet, because just think of somebody who has cleaning related OCD. It would make them so hard.
Right. Okay, Quincy, turning to Dr. Sigmund Freud, and he says that any truth to treating severe depression and alcoholism with cocaine, according to Dr. Sigmund Freud. I don't know if he said that or not, but I would imagine that treating any mental health issue with any sort of a drug like cocaine is probably not a good idea.
Um, she might be right because history tells us that Dr. Freud was having cocaine addiction.
Mm-hmm.
So it's hard to really differentiate the myth from reality these days.
Mm.
But yeah, I mean, there are research going on right now, especially for illnesses like post-traumatic stress disorder, where we are using some of the psychoactive substances like MDMA or ecstasy in microdosings to see if they are able to help us better in coping with those illnesses.
Mm-hmm.
So I don't say that we are yet at a perfect point in our civilization. We are still a work in progress. So you might see a lot of other chemicals coming up in future, but again, it's a controlled use of a thing rather than an uncontrolled use that's going to give us solutions.
And this is an interesting question, Quincy. I'll post some links here in the show notes that you can go and have a look at earlier, because I actually wasn't aware until that question that Sigmund Freud actually had a cocaine addiction problem, but apparently he did, which is quite interesting given the field that he was in. But I guess even sometimes mental health professionals suffer from some of the things that they're trying to treat as well.
That's true.
So incredibly interesting.
That's
Jackie, yes, sir.
Mhm. No, I was trying to just make a point that it's not true just for mental illnesses, but some of the best advisors of physical health are also not doing the healthy things.
Mm. Yes,
So,
it's like the
and
doctor who
again,
smokes, right? And you're like, "You're telling me to quit. Why are you smoking?" Or the doctor who's overweight, and you're like,
and again, it is also about
part of
social
being human.
acceptance. At the time at which Dr. Freud lived, cocaine did not have any recognized problems associated with it.
Mm.
And just remember 30, 40 years or 50 years from today, how much accepted smoking was, nicotine use
Mhm.
was,
Very true.
and where we have come from there. Maybe in next 30, 40 years, same would be said about alcohol. I don't know.
Yes, absolutely. All right, Jackie, who has done tremendous work in the field of Jackie Neal, mental health and wellness. She has set up Jackie, correct me if I'm wrong in terms of the correct name, but it's kind of a transition house in West Bay. I think was it last year that you had the grand opening for that, that allows people who are coming out of like a mental health facility or treatment facility to ease into their transition back into the community at large, because of course one of the more difficult tasks is that reintegration, if you will. So Jackie has done amazing work, and she's got a question for you this morning. She says, "Hi Sandra, can you engage Dr. Sharma in a discussion re dual diagnosis? While all MIs carry huge stigma, the dual diagnosed person often suffers twice as much. It is very difficult to treat and very hard to live with for the individual and their family and career." So let's get a baseline definition of what that is when someone says that you have a dual diagnosis.
Um, if I explain it in simple terms, it is when somebody has a mental illness linked with a substance use diagnosis.
Mm-hmm.
So people who are struggling with depression and they're also having alcohol addiction or any
Right.
other harder drugs, uh, cocaine or amphetamines
Mm-hmm.
as an addiction problem, then they're
Yes.
struggling on two fronts probably. And there are different ways to look at it actually.
Mm-hmm.
Now the newer understanding suggests that we should not be looking at them as two different diagnoses. One is an attempt to solve the first.
Mm-hmm.
So if we treat the first, then the implications to treat the second might not be as difficult as they are.
Very interesting. Luis says, "I find that smarter people are hyper and restless." Not necessarily. I think that's a bit of a I think that's again is a bit of misinformation that we put out there about smarter people, because again, a lot of us are trying to self-diagnose people or put people in a box when we see them, and when they don't fit that box, we think, oh, there must be something wrong here, or whatever. So, good morning, Miss Joy, who's joining us from Texas. Damien says, and then they're called a genius or semi-genius. Savant genius. Damien says, is common sense a mental condition? I think he's being facetious there, obviously. They have a saying now that common sense is really not so common. Charlene says alcohol is a drug and mind altering like any other drug, including prescribed medications, specifically according to one's existing health issues. Thank you, Charlene. And she also goes on to say that our community needs to further educate themselves and be extremely knowledgeable regarding mental health, so that there's less stigmatizing towards others. It's so sad and hurtful. Good morning to Rachel Ann. How are you? Rachel says, thank you for highlighting this very important issue today. And it's wonderful to learn that HCCI has a replacement mental health professional back on staff. So, folks, indeed, Health City's here to tell us that they can treat a number of different, mental health issues. They do have a mental health clinic, and services are available for those ages 16 and above, and it includes anxiety disorders. This is an outpatient treatment program, of course, and then they've got anger management, behavioral problems of late adolescents and adults, behavioral and psychological problems. We talked about that earlier, associated with an actual physical illness. You've got cognitive therapy and relaxation training. So exposure and response prevention therapy, along with crisis intervention, supportive psychotherapy for various mental health conditions, including grief and bereavement. Let me just pause on this one for a second here, Dr. Sharma. Sometimes a mental health episode can be brought on by life's stresses and trauma. So whether it's, COVID or the death of a parent or a child, they're very, very specific things that can throw one into, a situation where you need immediate mental health intervention.
Yeah, that's true. That's true. I mean, this is something that none of us would be untouched from, losing someone we love.
Mm-hmm.
So, but not all of us need to be requiring treatments or any sort of help.
Mm-hmm.
Reason being that there's something like a vulnerability or a weakness somewhere in the way we have experienced our lives until that point when that event occurred. So it acts like a triggering agent for all that has been building up for a while.
Mm-hmm.
So we do have to cope up with loss, but not all of us are at the same level of the ability to cope when we lose somebody we are close to. So it's specifically for that subset of population or people who are not able to cope to the extent that a person who was not vulnerable could be. I would like to bring up a point that was being discussed in one of the comments there about the medications. It's so true, and it's been stigmatized. It adds to the stigma too much that medications is something that somebody has to be on if they're suffering from mental illness or if they're diagnosed with a mental illness, which is so not true. Honestly, only 1/3 to maybe maximum half of the people who have mental illnesses do really need to be on meds, and that too not for their lives. Hardly 5% of the people who go through a mental illness, severe mental illness, need to be on medications, and there is nothing written anywhere that they need to be on medications and pills for the rest of their life. Most of the people are able to get better with minimal support from medicine for a very brief amount of time when compared to their lives. So that should not be a barrier in seeking help for most people.
So Carolina Ferreira, thank you so much for joining us this morning. She says, Sandy, it's important to point out that a person's mental health diagnosis is just that, their diagnosis. Their diagnosis is not the totality of who they are. If we are to end the stigma around mental health, we need to be mindful of our language. It is not he is bipolar. It is he has bipolar disorder diagnosis. And we must remember that language is so powerful. I was actually reading that earlier as well, Carolina. So thank you so much for that reminder. Thank you, Miss Charlene. And she's asking you to expound on the many various addictions that people can have And on this island, there's only two, cocaine and ganja is what people think. So one of the things that you do treat, it says here, is drug abuse and addiction related disorders, which include tobacco and alcohol. And you mentioned multiple times during this morning's program that it's entirely possible to be addicted to probably just about anything. I see you've got sexual problems on here. There are people who are addicted to food, addicted to sex and other things as well.
Yeah. The other day we were just discussing this also. And we are addicted to people too. The addiction goes to people too, and it is because of that addiction to people that we do struggle emotionally sometimes.
Right.
But more importantly, she's quite right in
I
pointing
think
out
some
that
people are addicted to CMR in the mornings. If I'm not
that's
here,
healthy addiction.
they're like, "Where are you? I don't see you." It's just a little joke there.
Well,
Folks.
you add value to them, so I guess that's a healthy kind of a addiction.
Thank you so much. Eating disorders, mood disorders, including depression and bipolar disorder, obsessive compulsive and related disorders, schizophrenia and other psychotic disorders, sleep related disorders, sexual problems, stress and trauma related disorders. I wonder if you could, I just see schizophrenia on here, and that's very, very interesting. Can you tell us a little bit about the difference between a mental health disorder and a personality disorder? Because I know sometimes people confuse the two when they see them.
I actually do not see the difference myself, because personality disorder are also diagnosed under the heading of mental illnesses. Having a personality is different from having personality disorder.
Right.
That needs to be differentiated. All of have a personality, but it doesn't mean that it amounts to a disorder. There are people in the world who have personality disorders where their nature of reacting to certain situations is predictable, and it is problematic, and it mounts to distress and dysfunction. So again, it's a matter of consideration, first of all, to identify that either this is an illness or a personality. Personalities actually tend to be more longitudinal, more having a long-term history, whereas illnesses, they are unusual in the background of what your normal personality is.
Right. So there's a number of, just for the benefit of our listeners, there are a number of personality disorders. The one that we probably hear a lot about that's, I'm sure, being overused and not correctly used is narcissistic personality disorder. There's borderline personality disorder, which I think is what the, in the Johnny Depp, I think that's the one that became sort of prevalent in that testimony that was given. And then there's histrionic personality disorder and antisocial personality disorder. So quite a number of them. Very, very interesting again, because this just shows how incredibly complex this particular speciality is really, and why you've got to make sure that you seek out professionals who know and understand what it is that they're dealing with. So on that note, Dr. Sharma, tell us a little bit about what you bring to the table as a physician, and why people should be, more than comfortable coming to you as an expert in this area.
I don't know how to sell myself.
Shamari, do it for him.
No. I mean, everything that we've covered here today, Sandy. If anybody feels that they're having issues that's actually disrupting their daily living or impacting persons around them, or if you are on the outside seeing that this is occurring and think that somebody may benefit from speaking to a professional, definitely pick up the phone 640-4040 or info@healthcity.ky. And Dr. DeWark mentioned that anxiety and depression in the cases you see represents about 80%, if I recall that correctly.
That's right.
Dr. DeWarker, before we leave, could you just touch on, because everybody, I would think at some point in time would have some level of anxiety, right? But when is that anxiety? What are the symptoms of when that anxiety actually leads to the point when you may need some help? Is just where I want to differentiate, just so people can understand why they should potentially give us a call.
Yeah, very pertinent question. Anxiety is a normal emotion for most of us, we do experience anxiety and we do panic about certain aspects of challenges we face in our lives. But anxiety that is overbearing, that's making us dwell on it, that's making us so hard for us to relax ourselves even when we need to. We often use the term to chill. It's too hard to chill if we are in that state of mind. If even though we know that we cannot possibly change the outcome of an event, but we are still worried about it to the point that we are not able to participate in other important aspects of life. That if is happening to you, then you're definitely going through an anxiety disorder. As I said, the label disorder should only be attached if we are seeing a certain amount of distress and dysfunction in our interpersonal lives, in our social lives, our professional lives. Often people find themselves angry. Anger is also a sign of being anxious. Most people don't recognize it, but anger is not a primary emotion. Anger is always driven by something else that you're trying to deal with, and most often it is worries and fears and insecurities that are driving that anger.
Right. So we have Michael here who has a question. He says, while healthy, we exercise to keep the body strong, so as to starve off physical illnesses and disease. What recommendations do you have for living to stay mentally healthy?
Again, with such corollaries, we are not realizing that we differentiate between mental health and physical health. The two do not exist in two different boxes. They work together. Anything that we do to keep ourselves physically healthy is definitely going on to add to your mental health, like exercise. Exercise is such a wonderful thing for mental health. I prescribe it for patients to not just for their physical health. I mean, they get value out of it because it makes them mentally rejuvenated and they get their head straight if they go for a run. Healthy eating.
Right.
When I say eating, it's not just from your mouth, but it's also from what you consume through your eyes and ears.
Oh, wow. So yes, of course.
It makes a difference. It makes a huge difference in how you will cope with a difficult situation. So these are some of the things which,
and meditation is something that has helped a lot of people as well.
Yes. I remember you mentioning that before the show. Yes, they're exclusively helpful in preventing mental illnesses, but a lot of times we often confuse them as something that helps in treating mental illnesses. Something having a preventive value is different from something having a therapeutic value. So one should definitely,
Yeah. So Marshall has a question. What's the difference between a panic attack and an anxiety attack?
No difference. These are normal general conversation terms that we often confuse with. Panic attack is a manifestation of extreme anxiety in physical form.
Wow. All right. So Soka says, I love a humble doctor. We're going to sing his praises just a little bit for him this morning. Dr. Diwakar Sharma is a consultant psychiatrist, folks, who joined Health City back in 2018. He specializes in various subspecialties, which include alcohol addiction, drug de-addiction, I should say, tobacco de-addiction, depression counseling, and psychological counseling, as well as schizophrenia disorder. He has a Bachelor of Medicine degree, Bachelor of Surgery, MBBS, and a Doctor of Medicine, MD from King George's Medical University in India. And he has a number of fellowships as well. He's got his MD in psychiatry from 2011 to 2014. And he has his Bachelor of Medicine and Bachelor of Surgery in Medicine back in 2005 to 2010. So lots of certificate of honor. He's been awarded the certificate of honor in the subjects of microbiology, pharmacology, ENT surgeon, OBGYN during his academic courses of MBBS. So definitely someone who's more than well qualified. Some special areas of interest include obviously mental health counseling, family therapy, psychopharmacology, anxiety management, and addiction psychiatry. So do you offer family therapy as well? I didn't really see that on the list, but if people want to come and see you as a family, is that something that's possible?
Yes, of course. I mean, it usually ends up being family therapy sessions because nothing lives in a box.
Exactly. I like that saying, nothing lives in a box. Keep telling y'all we're not an island by ourselves. Dr. Diwakar Sharma and Shamari Scott, another wonderful rundown Tuesday segment here on Cayman's #1 talk show, The Cold Hard Truth. Thank you guys so much for joining us. This was a very, very interesting conversation.
Definitely. Thank you for having us, Sandy, once again. And just to mention, for all you gentlemen, this Sunday is Mother's Day. Yes. Make sure you get your flowers. Make sure you have
make your reservations early.
You make your reservations or get ready to cook that breakfast. And Health City for Mother's Day also has our mammograms for $150 US. So go ahead, get that gift certificate for your mother, your wife, your sister, so that they can come and get their mammogram for $150. And people would have noticed that, in honor of Mother's Day product placement, I've been drinking my coffee out of this.
I love my wife mug, coffee mug. Wonderful.
Yes. So
yes. And what did they say in terms of mental health? Happy wife, happy life.
That's right. Trust me, all us married men know that very well. But I want to thank Dr. Dwarker for coming on. And Dr. Dwarker is here with us. Obviously, he's a part of the integrated team for certain things such as bariatric, but he's standalone as well. If you have any of the mental health, if you need mental health help in any of the areas that we mentioned, Dr. Dwarker is here with us. info@healthcity.ky or 640-4040. And the great thing about Health City is that we have so many different doctors that anybody walking within would never know, because I know at times there's stigma about who you're going to, what you're there for. Nobody will know why you're there if that's an issue for you.
Yes, and Celine did mention that, so I'm glad that you addressed that as well. Thank you.
Yes, so definitely come and see us.
All right, gentlemen, thank you so much. Appreciate it.
Thank you, Sandy.
Have a good one.
Bye-bye.
All right, folks. So again, the wonderful team, they're over at Health City. Let's go ahead and take a quick break, and we'll be right back after these messages.
For over 7 years, Health City Cayman Islands has provided life-changing and life-saving medical care for the people of the Cayman Islands at our hospital in East End. During this time, we have become an integral part of the community and now focused on connectivity and collaboration. Our vision is to make an even greater impact on the quality of healthcare for the people of our islands. In summer 2022, we will open a 70,000 square foot state-of-the-art hospital built on 3 acres of land at the southern end of Camana Bay, bringing much-needed specialized medical services closer to where people live, work, and play. Camana Bay, located at the heart of 7 Mile Beach, is home to schools, businesses, shops, restaurants, and entertainment. And now, Health City Camana Bay, a $100 million world-class hospital. Health City Camana Bay will have an advanced cancer care unit offering bone marrow transplantation and the latest cancer treatment technology. It will contain a modern neonatal intensive care unit, emergency and critical care, purpose-designed operating rooms for surgical specialties such as cardiology, neurology, and orthopedics, and robotic operating systems. A master plan for improved health care for the people of the Cayman Islands. Ready to meet the needs of our patients here and now, we have already established a footprint in Camana Bay with the opening of our clinic. Offering short wait times, extended opening hours, including evenings and weekends, and the ability to see our world-class doctors closer to where our patients live and work. The clinic has bright, comfortable waiting areas and treatment rooms, friendly staff, expert care, lab services, and diagnostics. Reflecting our operating philosophy of patient-centered care, convenient access to our specialist doctors allows our patients to focus on getting better rather than getting to appointments. With our unwavering commitment to our community and the thousands thousands of patients who trust us to care for them. We look forward to building healthier communities in a place where life unfolds, blossoms, and thrives. Welcome to Health City, Camana Bay.
All right, wonderful people. Welcome back to the program. We've got so much to cover today. So a bit of breaking news. You're probably going to say to me, Sandy, you've got to be joking. This is really becoming very, very interesting. More Cubans again. Yes, you heard me right. They have arrived in East End this time. So the people of East End are getting a bit of excitement this morning. Here's what we know. I don't have a fix on how many people, just having a look at the video here. But it looks like it's a handful that have arrived yet again on the shores of the Cayman Islands. So East End this time picked the lucky ticket for receiving some Cuban nationals. And I can tell you guys that Cayman Brac has been inundated. Someone made a comment which made me kind of chuckle. They said, well, the good thing about this is that that'll give the Brackers something else to focus on other than minding people's business. So I had to laugh because, there's a different pace in Cayman Brac. So a lot of Cubans the boats have been landing in Cayman Brac. But this morning, East End, right there by the Eastern Star Bar. So if you have any relatives or family in East End, you haven't heard from them this morning, that's probably what they're doing. They're out there looking at a little bit of the excitement and commotion that's happening out there. So if we can pull up the video here in a little bit, I'll show you guys exactly what's going on there. But in addition to that, we have someone who's reached out to us who want us to help dispel misinformation. It's so interesting that this person contacted me this morning. So I saw this phone number come in. And I thought to myself, oh, here's one that I don't recognize. They did call me yesterday evening as well after 10 o'clock. But, if you're not saved in my phone, normally after certain hours, I don't really answer the phone. Like I have to know there's some sort of emergency situation as to why someone might actually be calling me. And then I saw them call again early this morning. I answered it, of course. And they said, Sandy, the police have asked me to call you to help dispel this myth that is in circulation. And I thought, a myth in circulation, fake news? All right, well, we're on it. Tell me what's going on. And so this young lady said that and what is so interesting is I did hear this yesterday, that she has been accused. Now, remember last week, we heard on Thursday via the police during their RCIPS press conference that they had arrested a male and female in relation to the murder of Mr. Elliott there in Georgetown, close to School Road, off of School Road, right? And the female had been arrested for aiding and abetting essentially the other person who looks like is arrested for the primary offense of being involved in the robbery and murder. And so the police made it very, very clear that, listen, if you are involved, if you aid and abet, you will be arrested and you will be charged, you will be prosecuted, and you're looking at upwards of like 10 years imprisonment. So don't take this lightly. But for some reason, people have gotten the wrong person. I did hear this rumor yesterday, so I wasn't entirely surprised when this lady called in. So her name is Myra Valicia Bodden. And she actually has the business across the street. And she has other businesses. And she's saying, listen, I called the police. They said, call Ma Road. She'll help you get the word out there that it's not her that has been arrested. So folks, listen, we're all about getting people breaking information in news. And I know we live in a community where we all like to engage in the chatter and talk about, well, have you heard who got arrested? And, all this sort of stuff. But we've got to be very, very careful when we're putting out, especially when it comes to arrests, we're putting out misinformation about people. So I'm happy to confirm that Miss Myra Valicia Bodden is not the person the female that was arrested in connection to this. So folks, please ensure that you leave Miss Poor Myra's name out of your mouths in relation to this. She has nothing to do with this. She says, listen, I'm an upstanding business person. It's very, very important for me to follow the law and to act accordingly. And I don't want people thinking that I'm harboring any criminals involved in any sort of criminal activity. I see Miss Myra on the live Facebook feed as well. So Ms. Myra, I hope that this will go. I know how rumors work, child. They go around this island a couple times. But folks, please, please, please stop spreading this rumor. It's not correct. It's completely false. Ms. Myra Valicia Bodden had nothing to do with this. She's just in the vicinity in terms of a business, and she wants no part of this. And she is, very, very concerned that people are spreading this rumor. So I don't even know how a rumor like this gets started, to be honest. I have no idea. But Miss Myra, I did get a message yesterday, and I read it, and I just kept scrolling. Like, I didn't even really pay any mind because, I had not heard your name in connection to anything. So I'm glad that you reached out to us. Again, I hope that every person who's listening to this, tell one more person that, hey, it's not Miss Myra. Leave that poor woman name out of your mouth, as we would say in the Cayman Islands, because she has nothing to do with that. All right. So hopefully that's crystal clear. Again, folks, you've got to be careful. And I know there's certain people who want to dabble in news, but they're not really in news. And this is when the waters start to become a little bit more muddled. Because they're just looking for the attention that comes from throwing up a post that says, oh, we have some insight, we have some inside information, and we're right on the money. Well, if you're not in the money, you're negatively impacting someone's reputation, then that's a problem. So let's just try to be careful, folks, with the dissemination of information. And trust me, soon enough, we will know exactly who all of the parties are that are involved, because they're going to be charged and they will be showing up in court. So one name that we do know for certain that we can certainly share with you, we shared it earlier this morning on 106 in relation to the Friday manhunt. So one of the suspects that was arrested was now in court, Eric Brian Williams Soto. He appeared in summary court yesterday, and he is looking at charges of possession of an illegal firearm. And he was a young man, as you recall. There's two of them. One is still in the loose. Justin Kyle Jackson is still wanted by the police. And Eric Brian William Soto has been apprehended by the authorities from the incident. He's only 20 years old, from Newlands, it says. And he was one of two men stopped by armed police on the Esterly Tibbetts Highway shortly after 6 p.m. on Friday, April the 29th. So both men decided to flee the vehicle and make a run for it. But of course, William Soto, as he goes by, was tracked down a short time later and put in police custody. So he had his bail denied at this time, so he will remain in police custody. And, the Crown made a very, very strong argument to say that no curfew, no electronic monitoring would be sufficient enough to prevent or suitably deter the further commission of offenses. So it'll be interesting to see how this develops. His attorney is Amelia Fashuhini, who told the court that her client was simply helping a friend. These guys always have some story to go along with it. And that the good deed caused him to be accidentally caught up in the middle of a murder investigation. So interesting, because we were all wondering what they were wanted for. Well, now we know. Murder investigation. So according to his attorney in court, she said that after he was originally arrested, he was distraught, frightened, and confused, and in tears. Well, honey child, might be a little bit late for those tears now. I don't know nothing about that. But Magistrate Gunn, who presided over the matter, said that the car was being rented by Soto, was being driven by Jackson at the time the officer attempted to pull over the men. And so, Soto has been renting this car for over a month. And he also knew that Jackson was wanted by the police. So you can't get in a vehicle with a wanted man, because the police had put out notifications sometime before that Jackson was wanted. So you can't put this out there and now claim that, you're just helping out a friend, because technically that would be aiding and abetting as well. Anyway, he claims that he was on his way to his grandmother's house when he gave Jackson a ride. So we'll see how this falls out, folks. We will certainly, keep you updated. He also said that he ran because the police were shooting. Not quite so much. I think they shot because he ran. They shot a warning shot. Anyway, they went on to say that Jackson drove the car in such a manner that when it came to stop, both men needed to exit the car through the passenger's door. Her client told the police, "I ran because police were shooting and I didn't want to get hit." Okay. Don't quite think that's how it went down, but anyway. And she says that the obvious inference of two guns and two defendants is that one gun belongs to the other, but this is not the case. This is his defense already, his early defense. What a hot mess. She told the magistrate that if my client says that if what my client says is to be believed, and I would like to say that that's probably a big if what my client says is to be believed, which is information he received from Mr. Jackson, the second gun, which was recovered in the car, belonged to, listen to this, Kane Thomas, the young man who was murdered last week. What a mix-up story. So the second gun belonged to him. I heard a story yesterday of how his murder allegedly went down. And it's just a sad situation, folks. I mean, this poor kid walked right into a situation. Apparently, at first, if you're to believe what the streets are saying, he did have his guard up. And then he was approached by two people that I guess he thought were somehow his friends or his acquaintances or whatever. So he actually did, the story goes, he did have a gun on him when he showed up to the scene and, was ready for, I guess, a shootout. Like, why would you even go? But, he was quickly disarmed and put his gun down, so to speak. And then a third individual may have approached and unfortunately caused his demise. So that's the story yesterday I heard in the street. So I'm only selling it to you as I get it. So, Miss Amelia Fashuhini was asking the court to look favorably on her client's application for bail and said that he was a young man with no previous convictions, strong Caymanian ties, and a family willing to assist with whatever conditions the court imposed. What a hot mess. So Magistrate Gunn dismissed her comments about the ownership of the second gun as hearsay. And the facts before the court right now that there are two suspects fleeing from one car where a second gun was found. And Magistrate Gunn said the obvious inference is two guns, two suspects, and one gun belonging to each suspect. So she went on to say that given the likely lengthy custodial sentence, which will be imposed upon a conviction, there's little incentive for him to surrender to custody. And when remanding him into custody, she said, when stopped, he ran from police and tried to evade police, which tells me he had something to hide. So very, very interesting. And of course, all of you would know by now, folks, that a gun possession carries some significant 10 years if you go to trial and you're found guilty, or 7 years if you decide to plead guilty. So these are one of the few offenses in the Cayman Islands actually comes with a mandatory sentence. That is illegal or unlawful gun possession. So make sure you know. Good morning to Miss Barbara. She's wishing everyone a wonderful day. Thank you so much. She says, she says, Sandy, you're always number one on my list. Thanks for the great job that you're doing for all of us. You're most welcome, honey. Thank you so much. Quincy says, gossipers and spreaders of rumors are not journalists. Well, Quincy, no, but a lot of people are in the business of, we all talk in sus. And let me be very, very frank. I believe in complete honesty. The name of this show is The Cold Hard Truth, after all. So it is what it is. We understand the element of unconfirmed information, right? The whole name Cayman Marl Road kind of says it, that sometimes we will get unconfirmed information before the authorities are willing to say anything or to confirm it. And there are a lot of times it doesn't have anything to do with it's not accurate, it's not spot on, because sometimes they'll call us and be like, oh, can you not share that information? Because it might interfere with their investigation. And I've always said, listen, we don't have any problems with that. The issue that we find is normally the police wait until after the information's already out there before they call us. And I'm like, try to get to me beforehand. And a few detectives have, they kind of understand, because they'll call and they said, listen, we know that so-and-so was arrested and we're working a particular angle here. And so we ask for you not to divulge this information because this could impact the outcome of our investigations. And I'm always happy to do that, folks. Once I know. If I don't know, then I can't do anything about what I don't know, right? So, and people talk. We live in a society that people are talking. The second, an incident goes down, that's what makes CMR so successful, is because we are all about community news. You guys inform me. I had a young person a couple months ago stop me in Foster's, and they said, Miss, you that lady from Kimmermall Road? And I said, yes, that's me. How do you get so much information? Are you everywhere at once? And I said, if I had that superhero power, that'd be amazing. And so I said, no, I'm not everywhere at once, but people are everywhere, all over. And so we have an amazing community here that really shares information and puts information out there. And a lot of times people are sending it to me. It's like this morning, I'm not in East End. I'm in the comforts of my home studio in Lower Valley, Savannah area. But immediately, Cubans landing in East End, we're the first to know. People are going to send us the footage. They're going to send us the photos of it, video, whatever. And that's how it is. So lots of, the information that we get is by way of the community. And I love that element of CMR. We just have to be careful sometimes. And I kind of get a sense of certain things, right? So in our early days, we're coming up on our 5-year anniversary in June. Can you believe it? Oh my gosh, I can't believe it. But, I get a sense now of what sources can and can't be trusted. There's certain sources that come to me frequently with information, but they might only have a 75% success rate with how accurate the information is. So whenever those people message me, I kind of hold off on providing too much of the details. Like I wait until more information becomes available. So, normally they're close. They're in the vicinity of what happened. They're like, okay, a robbery has taken place. But when they start to give you details, they may not always have all the details as accurate as possible. So we'll hold off on a lot of that stuff and we'll wait, And then there are other times when we're in the thick of it because we've got the most reliable sources available. I told you guys about the gentleman, Mr. Alden Nixon, who unfortunately passed away on Saturday. We had an eyewitness there who was literally the person who saw him get in the water, saw him eating his banana. As a matter of fact, when he came up on his bicycle, they were there. They spoke. He sat down on the beach, had a little bit of struggle getting down on the beach. I mean, I had all the details of exactly what happened because we had a key witness, providing all the information, and they're very, very reliable. And this person was, in fact, quite emotionally distraught by, having seen this incident. And it's very, very difficult. I don't know if you guys have ever seen or ever been, we're talking about mental health this morning, but if you've ever been in a situation where you've seen an accident or seen someone take their last breath or seen someone die, but when you have witnessed that is something that never leaves you. I have unfortunately witnessed it myself after a man fell off of a roof post-Ivan. He was right there in town. I'll never forget this. I was walking with my cousin. It was a Saturday morning. We were trying to get life back to some semblance of normalcy. And so we were kind of out and about running some errands. And they're working on that roof where, I forget what the building's called, but it's where Star 92.7 used to be, right? Now, it's not the tallest roof in Georgetown, right? But if you fall off that roof and you have no gear on or whatever, it was a deadly fall. And literally we were walking by and this man just fell right in front of us. And oh my God, I couldn't believe my eyes. I was like, what? And so of course, I grabbed my cell phone, I called 911, and the emotional state that having witnessed something like that puts you in, it's very difficult to describe, I must say. And all these years later, that was the most traumatic thing about Ivan. It was even the storm or whatever. It was like witnessing this event afterwards. And I remember the 911 agent saying something to me, like they were just asking all these questions. And I literally just like screamed at her and I said, he's dying, like he's taken his last breath. Why are you asking me these ridiculous questions? Right. But of course I know that they have a job to do and they're trying to ascertain, not being there, exactly what's happening. But I said to her, I said, this man is dying and I see him taking his last few breaths. Please just try to get someone here as quickly as possible. And unfortunately, he did pass away. So, you know, no one ever wants to be put in that situation. But in this day and age, more and more, you'll find that it's entirely possible. And, you know, we got video footage of the EMTs working on Mr. Nixon. We opted not to make that footage publicly available and not to post it. I understand that some other, well, they're not a newspaper, but they kind of dabble in news, that they had it up and they were trying to attribute it to us. And I wanted to make it very clear that we saw the video, we had access to the video, and we made the decision because we know the sensitivities of the community. And this was a Caymanian, and a lot of people obviously knew that we did not want to put that video out. So sometimes, you know, we have put out stuff that I know offends people, and I don't particularly, you know, I don't want to say that I don't care about offending people, but, you know, we do have a job to do. But I do recognize in Cayman, people are offended by the slightest of things. Whereas other places in the world, this is like run-of-the-mill media. Like you would throw that video up and not even think twice about it. In the US, in Jamaica, and many other jurisdictions, Cayman quite isn't the same. So, you know, if I don't have someone who can oftentimes edit a video immediately, or a photo, yes, a photo. Sometimes I won't put it up. And, you know, what you don't see, you don't know that it didn't go up, right? So we use other footage that showed the EMT was on the location, but not the actual footage of them trying to work on him. So we do extend our condolences to anyone who has to, you know, deal with these tragic situations. 936 folks, Bobo is the telephone number. So big shout out to Kevin. He was listening to the program this morning, and he did confirm to me that they are working on the mental health show, and they'll be launching something shortly on CMR. So that will be an evening program. So I want to make sure that you guys tune in for that. So Marshall says, why would he be in a vehicle with a wanted man? He should know that at some point the police would have rolled up on him. He ran because he was guilty. If you have nothing to hide, then you shouldn't have any fear. Well, yes and no. And I'm going to tell you why, Marshall. I have done a significant amount of research. Now, I tell you guys, listen, I am not an expert. Well, I won't say I'm not an expert in anything, but I'm not an expert in a lot of different things. But I believe in researching and reading and informing yourself, because you can learn a lot. And believe me when I tell you that there are people who will run who are completely innocent. So the fact that you run, I know that's a saying all the time, like, oh, you wouldn't run if you're not guilty, you haven't done anything wrong. That's actually not true. When someone starts to chase you, there's a fight or flight mechanism that just triggers in. It's part of who we are as human beings. And if you don't believe me, I don't know, Marshall, or any of you who've ever had a puppy. I've had dogs pretty much my entire adult life, and I love dogs, as you guys know. When I was in the States, I had this little puppy named Oscar. That was my first responsibility, like my first puppy as an adult, right? So I'm trying to do all the right. I'm trying to be a good, responsible puppy mummy, right? So I take my dog, and this is when I was living in the States, and we go to puppy training. And one of the first things is, your dog can easily get killed if it does not understand certain commands. So there's certain commands that you want to teach a puppy from day one. Come, sit, and stay, right? Now, when you tell a puppy to come, sometimes there's an urgency behind why you need them to come. Like they're about to run in the street and get hit by a car. You don't want your puppy to get hit by a car. And one of the things that I got from that particular training course is if you chase a puppy, so you know when a puppy's running away from you, you chase it, then the puppy will run. And I thought about it. I'm like, oh yeah, you know what? You're right about that. So you never chase a puppy if you want it to come to you. Sounds counterintuitive initially, but it actually makes really, really good sense. So what they say to do is you turn away and you act like you're leaving the puppy. And then the puppy's like, what? My mommy's leaving me. My daddy's leaving me. Where are you going? And they're going to run back to you. Isn't that funny? And human beings are kind of the same way. Somebody chases you, you're going to run. Whether you did anything wrong or not, a lot of times you're going to run just out of the fact that, oh my God, somebody's chasing me, right? Totally weird and random, but it's true. Now, in this case, do we believe that he didn't do anything wrong? Probably not. The company that you keep and all of the other circumstances around this, he was obviously running for a reason. And folks, this is where you got to really be careful. So if you know, once again, that someone is wanted by the police, or even if you don't even know that they're wanted by the police, but you know they have a certain reputation, because again, Cayman is what it is. Most of these young kids, they'll know who's involved in gang activity or who's alleged to be involved in certain activities. Don't hang out with them. Don't have them hanging out at your house. Don't be going to Kelly's bar or Bananas or anywhere else flossing with these young men. I mean, someone sent me a photo of the poor guy there, Keen Thomas, who unfortunately, was executed by somebody that he trusted. Someone sent me a photo of him the weekend before saying these were the guys that he was hanging out with. They're like, Sandy, why was he hanging out with these guys at a particular bar in West Bay? I was like, Sometimes you got to not walk away from trouble. You need to run from trouble. And that can be difficult because Cayman is a small place. So if you need to extricate yourself from the Cayman Islands and go abroad to keep yourself safe and alive, then by all means do it. So Miss Charlene says, me too, girl. Lifelong learner here is my motto. Research, read, and investigate. Definitely knowledge is power, with or without a certification. Absolutely. And there's so much information, folks, that you can learn out there. You'd be absolutely surprised. So what else is popping off? Tomorrow's show, we're going to have some special guests in the studio, so make sure that you tune in. As you know, the situation BVI is very, very interesting. The UK is contemplating direct rule on the jurisdiction. So we have a number of people from BVI that will actually be joining the program. They were out protesting yesterday, honey child. Protesting because they don't want the UK to take over. And it is interesting. I think there's a lot of elements to it. So we will deep dive into that. And I'm happy to tell you guys, we're going to have a little bit of fun this morning. So we have a prize to give away. If you can guess who our special guest is on Thursday's show. So I'm going to queue up a little promo here for you guys. This is fun. I hope you guys really, really enjoy this. But we have a special guest who's coming in the program. I'm not going to give y'all too much in terms of information on who it is, because I want you to think hard. And I want you to throw out some guests. Yes, the school fight. Oh my God. Can we talk about that for a second? And then we'll do the guess segment. Marshall says bad company destroys good character. Chal, I think you're of good character. There's certain people you just don't hang out with. The truth be known. It's not even that it's destroying good character. You just don't hang out with certain people if you just don't do it. So yes, we had another school fight it happened on Thursday. And let me just say this much about it. We have quite a bit of insight into what happened. There was a post that someone put up, and I want to share this post. Thank you so much for the reminder there, Wee. So here's this comment by Gerald Bush. Now, I'm not sure who Mr. Gerald is. I think there's more than one Gerald Bush in Cayman. But anyway, so this one says, so a 7th grader was beat up by some 9th grader. Students because she wouldn't perform lesbian activities. Surprisingly, no word from the education department, not even in news. I would have thought CMR would be all over this story because we all know she's PAC. I keep saying every day that our governor has brought destruction to our islands and everyone is turning a blind eye. This man arrived with a manifesto from England and we're sitting here letting him carry it out. When they caught the 2 men making out in the parking lot of the nightclub a few weeks ago, because he was all up in arms with the 2 men that got beat up. Now the ball seems to have turned to cover up for the 9th graders, but that little girl that didn't want to participate, can't spell worth shit here, but let's move on. No justice for her. I wonder if this is because the governor is of the same flock. The old people always say birds of a feather flock together. Now this, Gerald Bush, your level of ignorance is shocking, but this is the most ridiculous post that I have seen. Well, y'all can put up some stupid posts, so I'm not even going to say in a long time. Probably, let's say this week, he could get jackass of the day. So first of all, let me clarify a few things here. Number one, that fight had nothing to do with lesbianism. Y'all are so obsessed. You talk about maybe the governor's of the same flock. Maybe you're of the same flock, Gerald. Let me be very, very clear here, right? People who are obsessed with everything having to do with homosexuality and lesbianism and gay and this and that, y'all are the ones who are obsessed. This had nothing to do with that. For months, actually years, CMR has been the only media outlet that has been talking about these children fighting in schools. And now you want to come at me about, oh, you never mentioned this. I'm not mentioning it because it simply isn't true. I actually did my homework, unlike you, Gerald Bush. I know exactly what happened. And the young lady involved in the fight, and I do have the video, which I'm going to cue up here in a second. She has been involved in other fights before, and it has nothing to do with being a lesbian. These kids are just bad kids. So when we were having this discussion last week, Gerald, and we were talking about, you know, these bad kids and the girls fighting and the boys fighting, whatever, where were you in the conversation? Where were you? You're talking about, oh, I'm not talking about it because I'm PAC. What are you talking about? We were talking about it, and it seems to me like you were simply not present. Okay, so you don't turn up to class, you don't hear the discussion, and then you want to criticize people? Child, take several seats. This young lady is the same, one of the young ladies, she didn't start the fight, but she was all mixed up in it. She is the same one who was mixed up in, hold on now, let me get the information here. She was the same one whose brother came on campus to defend her recently. Remember when he came on campus and was telling her, oh, go get his machete or his gun or whatever out the car? This is the same young lady involved in that situation who was just suspended for fighting, by the way. Why didn't you mention that, Mr. Gerald? And it had nothing to do with no lesbianism. Okay. So here's what someone said. This was picking up on the girl from a week ago. My daughter was in the bathroom using it, and she came up to, a group of the girls came up to her, and she said she didn't want to fight. And she was hit a couple times, and she didn't hit back. The school is hiding these things. When I saw that video, I sent it to the principal, and this was his response. And they sent me the screenshot. And the parent said, this is the fight today. And can so-and-so in the back, gray sweater, hitting the girl, because she's always in the mix, this little girl. The principal replies, yes, we have that, but many thanks. The matter is being dealt with, and thanks for your support. The parent says, the reason why I'm sending this to you is because it clearly shows that this little girl has issues and that she looks as if she wants to damage the girl. This is truly unacceptable. Well, the principal didn't respond after that. We have talked about, I'm nauseated by how much we've talked about the fact that the education department is not handling this correctly. The police are not handling this correctly. The parents are not handling this correctly. And the school administrators are not handling this correctly either. These young people need to start being charged on a serious note. Now, listen, they always say there's some element of truth in a story. So here's what actually happened. One of these little girls went up to another little girl and started gyrating on her. Does that mean she's trying to be a lesbian or she wants to be a lesbian? I doubt it. Right? That's just what kids do. That's what people do. They want to wind up on you because y'all been teaching them that winding up and dancing on people is A-okay. That's a slackness y'all teach your children. That don't have nothing to do with being a lesbian. That is just regular slackness. Let me see. So, Gerald, I want you to be very much aware that we have been talking about these hoodlum children for a long time. You need to catch up with the conversation. And y'all parents need to do better. Right? So stop making this about something that it isn't. Because all of a sudden it's a national issue because, oh, they might have been trying to convert this young lady to being a lesbian. Child, please get yourself together. You sound extremely ignorant in this moment. But this is the point. That the hate for that community is so strong that y'all just want to blame any and everything on the poor LGBTQ plus community. Meanwhile, they're one of the most peaceful communities in this country. It's not them that's going around fighting and causing havoc. It's your children. You guys are raising a bunch of animals as children. And the only time you think it's important to even post about it is when you think that, oh, it's because it's surrounding lesbianism. You need to get a clue, and you need to get your information correct, Mr. Gerald Bush, before you try to come at CMR, myself, or anybody else in this community, including the governor. Now, I don't need to speak for the governor, but what I'm going to say to you is you are woefully misinformed. And the fact that we're the only ones who've been having these conversations about these fights in school is even more egregious that you would post such a ridiculous comment. Shab, please, you need to take several seats. What a mess. Comments, let's see here. We've got lesbian sheep. Ooh, where, says Damien. Aliana says these Trump-level dingbats. Marshall says he was absent from class that day. Now he wants to talk. You understand what I'm saying? You don't even show up to school, much less class. And now you want to be an expert on what CMR is talking about and what CMR is covering? Like I said, go back to 2018, 2019, when we started the conversation as the fights were happening. And none of those fights, honey child, all 5-6 fights a day. You're not talking about that, but none of that has anything to do with lesbianism, right? Let's talk about the real issues in this community, folks. Charlene says, sounds like one that loves to bully, just saying, don't have all the details first to admit. Yeah, I mean, this young lady clearly has some issues. And if the school doesn't rein her in and she ends up, seriously injuring a child, those parents need to sue this government. And I will be the first to say it, because they are not handling this situation. We have yet to hear from the ministry on these ongoing fights. The Department of Education, nobody, the minister. Well, she mentioned something in 2019 that, they were going to pray about it. Prayer is fine, but that ain't the answer here. These young people, no amount of praying can help them, child. They need I don't want to say an exorcism, because God knows one of your administrators tried that already, and clearly that didn't work. Oh, by the way, again, remember that exorcism incident? What was that all about? This principal is asking 3rd and 4th graders if they're lesbians. I'm telling you, this country has a sickness, a hatred towards that community that y'all need to check yourself. Y'all need to really try and read your Bibles and exercise yourselves, because it's just so stupid. That's why she performed that exorcism with holy water and all kind of foolishness on these poor kids. They didn't even know what the term lesbianism meant. They're like, what's a lesbian? I'm like, oh my God. This is the kind of ridiculous behavior that we are encouraging because of people who hate other people just for who they are. And those people are not harming nobody. You need to check the child molesters in your community who are completely straight. You're not outraged about them. Isn't that funny? I'm just saying. 9:29 and 23 seconds. Damien says nothing is being handled correctly. Immigrants, drugs, gangs, rapists, and more. Venice says, can they interview the child that was beaten up and hear her side of the story and see why this is happening? Well, you can interview all the children. You got 5 a day because there's about 5 fights a day. So this isn't an isolated incident. This is what shocks me about it. This is not an isolated incident, folks, where this is so unusual. This is happening every single day. I've got friends who send their kids to John Gray. They, went from the Adventist school into John Gray, the nicest, sweetest little kids, and they are being targeted for no reason. They're not in the mix. They're studious. They're, focused on their studies. And, oh, yeah, she thinks she's better than us, or she has long hair, or she half Indian or whatever. This is the foolishness that is going on in these schools. And you parents need to wake the hell up. That's all I'm going to say. Folks, that's another segment of the cold, hard truth. Y'all want the cold, hard truth? That's the cold, hard truth. Wake up and stop trying to blame bad behavior and lesbianism, because I ain't got nothing to do with it. You all have a wonderful day. Tuesday, May the 3rd. We'll see you tomorrow morning.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.